Golfer's elbow is a form of tendinitis that causes pain and inflammation in the tendons that connect the forearm to the elbow. The pain centers on the bony bump on the inside of your elbow and may radiate into the forearm. The medical term is medial epicondylitis. Golfer's elbow isn't as well known as tennis elbow. While both are forms of elbow tendinitis, tennis elbow stems from damage to tendons on the outside of the elbow, while golfer's elbow is caused by tendons on the inside. Golfer's elbow is less common. Causes. Golfer's elbow is usually caused by overusing the muscles in your forearm, which lets you grip, rotate your arm, and flex your wrist. Repetitive flexing, gripping, or swinging can cause pulls or tiny tears in the tendons. Despite the name, this condition doesn't just affect golfers. Any hand, wrist, or forearm motions that you do often can lead to golfer's elbow. Things that can lead to golfer's elbow besides golfing include sports that use a racket, like tennis, as not using the right techniques when playing or using them incorrectly can hurt your tendon. Sports that rely on lots of throwing movements, like archery, baseball, and football. Pitching a ball incorrectly can lead to golfer's elbow, too. In fact, it's sometimes called pitcher's elbow. Repetitive movements. If you're a carpenter, painter, plumber, or you work in construction, you can get golfer's elbow. Weight training. If you don't use the right technique for lifting weights, you can overwork your elbow's tendons and muscles. People may also get it from using tools like screwdrivers and hammers, raking, or painting. Symptoms. With golfer's elbow, the pain you have can happen suddenly or with time. If you have golfer's elbow, you might have stiffness in your elbow, tenderness, and pain, usually on the inner side of your elbow or the inner side of your forearm, but you could have pain with certain movements, like making a fist or swinging a golf club, tingling or numbness in your fingers, usually the ring and little fingers, weakness in your hands and wrists. Diagnosis. Golfer's elbow is usually diagnosed based on your medical history and a physical exam to evaluate pain and stiffness. The doctor might apply pressure to the affected area or ask you to move your elbow, wrist, and fingers in various ways. An X-ray can help the doctor rule out other causes of elbow pain, such as a fracture or arthritis. Rarely, more comprehensive imaging studies such as MRI are performed. Treatment. Treatment begins with avoiding activity that causes pain. To help relieve pain, use ice. Medications. You can take an over-the-counter pain reliever. Try ibuprofen, Advil, Motrin IB. Others, naproxen, sodium Aleve, or acetaminophen, Tylenol. Others, corticosteroid injections, are not commonly given because they haven't been shown to be effective long-term. A newer treatment being tried is platelet-rich plasma. This involves drawing a small amount of your blood and injecting a concentrated amount of platelets and other anti-inflammatory factors into the tender area. More studies are needed to evaluate the effectiveness of this treatment. Therapy. Try the following: rest. Put your golf game or other repetitive activities on hold until the pain is gone. If you return to activity too soon, you can worsen your condition. Ice the affected area. Apply ice packs to your elbow for 15 to 20 minutes at a time, 3 to 4 times a day for several days. To protect your skin, wrap the ice packs in a thin towel. It might help to massage your inner elbow with ice for 5 minutes at a time, 2 to 3 times a day. Use a brace. Your doctor might recommend that you wear a counterforce brace on your affected arm, which might reduce tendon and muscle strain, stretch, and strengthen the affected area. Your doctor might suggest exercises for stretching and strengthening. Progressive loading of the tendon with specific strength training exercises has been shown to be especially effective. Other physical or occupational therapy practices can be helpful too. Gradually return to your usual activities. When your pain is gone, practice the arm motions of your sport or activity. Review your golf or tennis swing with an instructor to ensure that your technique is correct, and make adjustments if needed. Surgery. Surgery is seldom necessary, but if your signs and symptoms don't respond to conservative treatment, in 6 to 12 months, surgery might be an option. A new approach called the Tenderness procedure involves minimally invasive, ultrasound-guided removal of scar tissue in the region of the tendon. Pain. More study is needed. Most people will get better with rest, ice, and pain relievers depending on the severity of your condition. The pain might linger for months to years, even if you take it easy and follow instructions on exercising your arm. Sometimes the pain returns or becomes chronic. Thanks for watching. Don't forget to subscribe.